Good morning, everyone. Hope everyone can hear me okay. Sorry, I had some technical difficulties. It wasn't letting me go live for a few minutes there, so just got those worked out. Um, so good morning. Happy Easter Sunday. People of the Jewish faith are in Passover, so I honor that also. Actually, I'm going to come off of the earphones. This makes me feel weird. Hope everyone can hear me okay. Today I'm going to be talking about virus basics. And we will talk about, what a virus is, what happens when a virus infects us, how we respond, we get immunity, talk about the coronavirus and what we know about how it impacts different ages, studies we've had about how many people are actually infected and the fatality rate, that kind of thing. And some treatments that some might be available now and some might be available on the horizon. So, let's get started. Good morning. Can everybody hear me okay? Just give me a thumbs up or something. Just let me know that it's all working okay. As I said, I had some technical difficulties this morning. So don't want to get going unless we got that worked out. Okay, so we will get going, and if you have questions, put them in the chat. So what is a virus? We're getting down to basics here. So virus is essentially genetic material, DNA and RNA wrapped in a protein coat. Virus is incapable of reproducing on its own. It doesn't have the essential cell machinery to do that. So it needs a particular host cell to come along. Since coronavirus is in the news, we'll talk about the coronavirus. And for the coronavirus, the host cells line the respiratory tract, including the nose and mouth. This is, so that's why it's so important to keep those covered. Also explains why most of the complications are respiratory. Virus enters the host cell and hijacks the cellular machinery. It makes proteins that will keep the immune system at bay, so it won't be destroyed before it can actually cause an infection, and other proteins that assemble new copies of the virus. Now, if you're already immune, usually attack the virus before it gets into your cells with your antibodies. But if you're not immune, this is what happens. Gets into your cells, hijacks the cell machinery, and starts producing copies of its own virus cell. Each infected cell can release millions of copies before the cell breaks down and dies. These copies may infect nearby cells, end up in droplets that then escape the lungs and bodies through the mouth and nose, in the respiratory case, and infect other people. Inside the body reacts with fever and mounting an immune response. One type of cell we have is called the natural killer cell. Look for cells whose membranes don't look quite right. Kind of like, the people looking at people and they don't seem quite right, and they kind of attack before they're attacked. Usually, this doesn't happen quite enough, but it's one of the body's first line of defenses. Another line of defense we have are what are called T cells. T cells are actually looking for specific cellular membrane markers to tell the T cell that there is a virus inside. If it finds that, it'll destroy the cell. Also, call in essentially the cavalry, the B cells. B cells come in and produce specific antibodies against the virus. When we develop antibodies, we have become immune to the virus and can now clear it from our system. So that's how this is all supposed to work. Sometimes the immune system overreacts and releases too many inflammatory molecules. The term we hear in the news is the so-called cytokine storm. It ends up damaging tissue. In the case of the coronavirus, the tissue it's damaging is lung tissue. This is when people end up on ventilators. In about 1% of cases, people die. This will vary with age and underlying condition, as we will discuss below. Fatality rate is determined by the number of people who die versus the number of people with the disease. So in a population, if you're doing tests, you're only getting confirmed cases. If you're testing the entire population, then you can get a true case fatality rate. But the less you test, the smaller the denominator. Therefore, it is by a simple math equation, the mortality rate looks higher. South Korea, which I believe did the best job testing and reporting in its population, had a mortality rate of 0.6% overall. There was another interesting case study where the Diamond Princess, which had 3,700 passengers and crew, they were essentially an isolated community. They had 700 people infected. They had quarantined everybody once they realized that people were getting sick. And interesting thing about that is they were able to determine about 18% of people had no symptoms that were actually infected. 7 people died for a fatality ratio of 1%, 7 divided by 700 people. So again, fatality ratio 1%. That's where I'm getting the 1%, 0.6% in South Korea. Much lower than some of the reported fatality ratios that we've talked about. Though, again, the more testing that is done, the better we can determine those numbers. Once we have widespread testing, see not just who is currently infected, but also has had the illness and is now immune, we will have a better idea about the actual fatality rate. Here's our best info right now, and this will be subject to change as we get more and more people tested. I believe National Institute of Health is going to be doing testing, voluntary testing, to get better ideas. So in the as a breakdown by age to 10 to 39, 0.2%, and there's a low rate of reported infection if you're younger than age 19. So that's hopeful for our children, and just about all of them recover. Age 40 to 49, the rate goes up to 0.4%. Age 50 to 59, 1.3%. Age 60 to 69, rate now goes up to 3.6%. 70 to 79, rate goes up to 8%. And over 80, the rate has been reported to be as high as 14.8%. So I said these numbers may change as we get better ideas of who actually has the virus. Any questions on any of this so far? Anybody comments? Another thing that was interesting is that if your medical system gets overwhelmed, as it did in Wuhan, then the mortality rates go up, spike up, just because you can't take care of everybody. Wuhan, as mentioned, was overwhelmed, had a case fatality rate ratio of 5.8%. The rest of the country, spared from being overwhelmed, had a 0.7% rate. So I think this explains why many states decided to put people on lockdown to keep the number of cases down. Mortality skyrockets if the system gets overwhelmed. Treatments. Vaccines are being developed, and some are even entering trials already. But don't expect them for a year or more. Testing of efficacy and safety needs to be done first. I'd be very surprised if we even saw them before a year and a half. Other treatments. Of course, we've all heard of hydroxychloroquine and chloroquine, combination with Zithromax. May alleviate the infection and prevent it from becoming more severe. Trials are ongoing. One of the New Jersey critical care doctors said that they hadn't had spectacular results from that. There is Attorney General in New Jersey. I don't know what's happening in other states, but the Attorney General in Jersey has made hydroxychloroquine, not sure the exact terminology, but an emergency drug, because people were stockpiling it, people who may never need it, also pulling it from the shelves, and so people who have, for example, rheumatoid arthritis were unable to get it. So we want to make sure that supplies are available for those people. Then there are trials of another rheumatoid arthritis drug, Sirayumab, helps to modulate inflammation. It's an immune suppressant, essentially, helping in people who maybe have that overactive inflammatory response. The cytokine storm could help. There is some preliminary data that it could alleviate that. Might be able to prevent people from going on a ventilator, or if you're already on a ventilator, maybe coming off more quickly, since it will help, again, alleviate the cytokine storm. Then they're using specific antiviral inhibitors, remdesivir, remdesivir, and then some drugs that are have been used in HIV, ritonavir, ritonavir, and lopinavir, lopinavir. Again, those latter two, the ritonavir and the lopinavir, both HIV drugs. What they're doing, though, since obviously HIV and coronavirus are not the same virus and therefore don't have the same shape, what they're doing is they're actually altering the shape of these drugs to better fit the coronavirus, to have better efficacy. Kind of interesting approach. Again, trials are ongoing. And then they're bringing back an old treatment, convalescent plasma, meaning someone who has been infected already, and they are taking the plasma from those people, and essentially it's presumed that there are antibodies in there, which we know from antibody testing that there is, and they're using that. This was I feel that this was possibly used during the Spanish flu epidemic in 1918 that killed so many people, over 1 million people. They used this during H1N1, was effective then. And it's being used now in some research facility for severe cases and shows some promise. So those are pretty much a rundown of the available treatments. Anybody have any questions on that? Just checking to make sure I'm not missing any questions or anything. I don't see any. So what are the things you can do now to keep yourself healthy and your immune system in balance? Good morning, Nancy. Good to see you. So here's a list of things you can do to keep yourself healthy and your immune system in balance. If you smoke, certainly a good thing to do now would be to stop. You can certainly get some help from your healthcare provider, but that would, certainly be one of the things I would recommend. Stop smoking. Start eating for your diet. Eat a diet high in fruits and vegetables. A low processed carbohydrate type diet, low anti-inflammatory, an anti-inflammatory diet that can certainly help strengthen your immune system. Get activity. If you can't get outside, do something inside. To use an exercise video. But if you can get outside into the sunshine and fresh air, then I would recommend that. Maintaining your social distancing, of course. If you're not at a healthy weight, try to, again, just by changing your diet, oftentimes people start to lose weight without officially doing a weight loss diet. Drink alcohol, drink only in moderation. Make sure you get adequate sleep. That is very important. Adequate sleep is extremely important to help your immune system. That's when your body really gets into that parasympathetic state where modulate the immune system and really heal what's going on. Try to deal with stress, minimize stress, but we all have stress in our lives. We are certainly all having stress right now. Stress impacts the autonomic nervous system, and the autonomic nervous system impacts immune function. That is the link between stress and our immune system, the autonomic nervous system. Things you can do to help with that are things like meditation and yoga, reading a good book, taking up knitting or knitting, if you're already a knitter, good for you. Whatever gets you into a relaxed state can impact your autonomic nervous system. Anything that gets you out of feeling that stress situation. If you suffer from chronic cardiometabolic diseases such as obesity, diabetes, heart disease, or hypertension, then taking steps to stabilize these diseases is important. And even going on to reverse some of these diseases rather than settling for the current model of disease management. We at Princeton Integrative Health are much more about first stabilizing your diseases and then reversing what we can. Could be your most important takeaway from today, because not only are we talking about the coronavirus, which is current now, but we want to future-proof your health is the terminology we are using. Future-proofing your health, meaning what you do now, you influence how healthy you are down the road, and when whatever your next health challenge is, whether it's an illness of your own or whether it's a pandemic illness, you will have developed more health resistancy, um, and um, more health resilience, so that whatever your challenge is, you can weather that storm better. We certainly want, that's what we're looking for in all our patients and for all our communities and for everybody. That's what we want, whether we're helping you or someone else is helping you. We want people to have more health resilience, more ability to weather those storms. Check out Jenna's immune support group and more group for other great tips. You know, more ideas to future proof your health. So, just want to mention a little bit about testing. Um, two ways to test. We could do most of the testing that drive-in testing that you can do now. They're swabbing people's nose, and then they're doing viral replication testing. They're looking to see if there's evidence of the virus. It's rapid, but can only tell if you are currently infected with the virus. Doesn't tell us who's had the virus and is already immune. Antibody testing tell you if you've had the virus and have developed antibodies. That tells you if you're immune to COVID-19. This is important if you want to re-enter the workforce. If you're immune, you can safely re-enter the workforce and be safe as long as we are dealing with this current viral infection. Sometimes viruses do mutate, but shouldn't happen in the short term that we're talking about. So if you have the COVID-19 viruses, you will be safe from COVID virus 19 antibodies. You'll be safe from the COVID virus. I mentioned that NIH is looking to do some voluntary testing. One of our lab vendors also has a test pending FDA approval. As soon as they get FDA approval, and we expect that sooner rather than later, we can offer that test to people also. At-home finger prick test that is shipped directly from the company and can return directly to them. If you are interested, I'm going to post a link so you can do that. All right, this was kind of sciencey. Do people have questions? Do people like hearing about the science? All right, folks. Everybody enjoy their Sunday. Happy Easter to everyone who's celebrating that. Happy Passover to everyone who's celebrating that. Our next Facebook Live will be on Wednesday at 12:30. And I hope to see you then. And then, it'll be Wednesday at 12:30 and then again next Sunday at 9 a.m. Okay. Thank you so much. Thanks for tuning in. And I will talk with you soon. Okay.